Here we go. Okay, so future planning. BBS UK Board of Trustees and the staff team have been working extremely hard over the past 5 years, strengthening the charity's organisational structure, governance and financial position, and developing its core services and activities. The charity's updated its name and logo, developed a comprehensive range of information resources, and has redesigned and updated its website. So I'm going to briefly outline our core services. This was covered in some detail during yesterday's session, so apologies if some of this feels repetitive. So our core services are our BBS clinics patient liaison team. They provide the support, facilitation and advocacy services at our multidisciplinary clinics. Our advice service supports members with accessing local support across the areas of health, education, social care and benefits. Our keenly anticipated and much missed this year annual family conference weekend brings the BBS community together with interested professionals and experts to provide access to the latest research and share experiences. And I know all of you feel the same. We are so looking forward to being able to meet up again next year. And we have an excellent range of information booklets available in print, audio, PDF and Word. So let's just go through those quickly. So our medical information booklet provides an extensive overview of the syndrome and includes recommended tests, monitoring and signposting for additional areas of support. Introducing Bardet-Biedl syndrome, this is more or less a summary of the medical information booklet and is also available in easy read, Urdu and Turkish. Our booklet for schools and colleges. Now, this is a fantastic resource for those working with young people in a learning environment. It covers relevant aspects of the syndrome and offers practical tips and solutions. And at the back, there's a pull-out section for the students to complete. And that information then goes on to a student passport, which provides a mechanism for our young people to tell their team what they think they need to know to understand and support them. And we also have an EHCP and SEN information leaflet for parents and outlining the SEN process and providing ideas and suggestions for improved advocacy. And our transition handbook, My Life, My Future. Now, this one was produced for young people of transition age from around 10 years and onwards. For the younger end of the age range, it provides a structure for parents to have conversations with their children about BBS and the future, which can be, it's tricky to know where to start. So that provides a nice framework for that. And it's never too early to start thinking and planning with our children and young people. 16 comes round very quickly. And we're soon going to start work on transferring this booklet into an online resource for our young members. So we have our website, we produce regular newsletters, our social media, which is invaluable for us all to keep in touch and support each other. And we have our young people's group and adults focus group. So moving on, future planning, we are now looking ahead at the next few years and what resources and services that are going to be most needed. To help determine what that looks like, we have undertaken a membership audit, which some of you may already have completed. So we launched this, I think it was in December, and the questionnaire aims to assess and identify how BBS affects those diagnosed and impacts on their quality of life. We want to know how well those affected have been supported by BBS UK, but we also want to understand is what are the gaps in the service we provide. We want to know what services are being accessed, including those external to BBS UK, and what members would like from us in the future. So our hope is that the questionnaire will support us with making the best decisions of what our priorities should be and how we should direct our resources. And we want to improve our knowledge of the impact that BBS has on patients and their families to enable us to provide the best support. And we want to understand, what are the gaps, not just from BBS UK, but other support services. And this will help us. We can lobby for change. We can lobby for to access those services on behalf of our community. So that is still open. It's available. I think you can access it from our website. It's a Survey Monkey. You can also get a paper copy if you contact Liz, our office manager. So I think we've got about 75 completed, and ideally we would like 100 before we close. So that's finishing off with core services and activities. We've used some of those, the team meetings and focus groups. So they're also areas that we've used to understand the key areas of need. And these focus groups have given us an idea of what we need to focus on. And that's all going to go together with the information from the membership audit. But from what we've got so far, we've started putting together our 5-year strategy. And that's helped us deliver, that's helped us to develop our vision, mission and values that will underpin all that we do. So our vision is that our unique experience, knowledge and understanding of Bardet-Biedl syndrome will ensure that everyone who accesses our services is supported, connected and informed about BBS and are empowered to achieve the best possible outcome. Our mission is a commitment to promoting positive health and well-being within the BBS community, to improving knowledge and understanding amongst those affected, the medical and educational professionals and the wider public, and to supporting research and raising awareness of Bardet-Biedl syndrome. So we've identified 5 key values that are at the heart of BBS UK and have been since it was founded more than 30 years ago. BBS UK is committed and passionate. We are committed to achieving the best possible outcomes for our community and are passionate about improving the lives of those affected. We are inclusive and community minded. We value diversity and we strive to ensure opportunities are available and open to all. We have deep experience and understanding of Bardet-Biedl syndrome and the impact it has on our community. We understand the needs of our membership. We are positive and forward-looking. We take a positive attitude towards challenges and we stride forwards with optimism and open to opportunity. We are collaborative. The voice of our membership is at the heart of our work. We seek out and listen to their experiences and to the expertise of others, and we share best practice. Just as they were in the beginning, these values remain fundamental to the work of BBS UK and will underpin all future developments. The membership audit, as I said, is still live. We would like more of you to contribute before we close, analyse and summarise, and I cannot emphasise enough how important it is to us to understand directly from you how we can best direct our resources and services. From our work so far, on a broad level, we expect our future services to include the following. We want to improve communication with our service users. We have a diverse community with diverse communication needs, and we understand that not everyone uses social media or email. Sometimes that might be the easiest way to communicate, where we understand that it's not always best. So we're going to entail, what is this going to entail is making sure our database includes up-to-date consents and communication preferences and build communication needs into all aspects of our work. We want to develop and grow our advice service and support provision and develop a network of volunteers to provide peer support. We want to build communities, including regional groups and online social groups. We want to empower our membership to achieve, and we aim to develop a transition service for young people and look for ways to support our community with improving self-advocacy skills and with accessing volunteer opportunities and employment. We will continue to strengthen the governance of BBS UK and raise our profile, and with a focus on improving diversity and filling gaps in the skills and experience on our board. We want to develop a professionals supporting BBS group, bringing together a network of people who have the skills to support BBS UK with its work. We are committed to seeking out opportunities at a national and international level to improve awareness and understanding of BBS. And recently we became a founding member of BBS International, and we're looking forward to working with the international BBS community. And lastly, we will continue to support research and understanding of BBS. It's an integral part of the history and future of BBS UK, and we are keen to engage with rare disease research to share experience and knowledge of our genetic condition with others. The words that really stand out in our development plans are together, support and community. Team BBS UK is made up of trustees, staff, volunteers, members, supportive professionals, fundraisers, donors, campaigners, supporting charities and organisations. And that's all of you who have joined us today. And that is how we will make this happen. Your support will be vital. Volunteering can take many forms. It could be fundraising, you could become a friend of BBS, raise awareness locally, support the development of regional groups and support activities and events, or sign up as a professional supporting BBS. If any of this sounds like something you could help with, please get in touch. Our contact details can be found on our website, www.bbsuk.org.uk.